And so today I was going to talk a little bit about some of those issues. Some of the issues are the same issues that couples experience when they're trying to get pregnant for the first time. But there are some things to look out for. There are some things to be mindful of, and things that can be done as you plan for that second pregnancy that hopefully will make it a little bit easier and will help avoid needing to come see a specialist such as myself. So when we're trying to understand why a couple's unable to get pregnant, there are different things that we look at. As women get older, it becomes a little bit more difficult to conceive. We know that there are simply age-related changes that affect the quality of the eggs. The most ideal time for a woman to get pregnant is around age 22 or 24, which is pretty young these days in society. After that, the likelihood of success begins to gradually decline, such that by 30 or even 35, it does become more difficult to conceive. On average, the age of the patients that I'm usually seeing is 37, 38, 39, having their first pregnancy and experiencing difficulties at that stage. And the majority of those women have issues with the quality of the eggs that are being produced at that time. And one thing that anyone who is yet to plan a pregnancy or is thinking about a second pregnancy has to keep in mind is the fact that over time it does become a little bit more difficult. And it's normal for it to be more difficult as individuals move through their reproductive years. And back in 1970, the average age of a woman having their first child was 21. Now the average age for a first child is 26. That's a 5 years difference. That's 25% greater time for having that first pregnancy. 25, 26 is still pretty young for many individuals to have their first child, but it's already in a stage in which it becomes a little bit more difficult for pregnancy to happen. And so even though it seems, if you pay attention to the news or you wonder why there are so many fertility clinics around, it seems that people are having more difficulties getting pregnant these days. We like to blame that on the environment, our lifestyle, health, other things that go along with this modern world. But the reality is that things probably haven't changed that much with our bodies or with the environment. It's just that our society has changed a bit, such that we're delaying having children until a later age, and there's nothing that we're going to be able to do now or in the future to change how easy it is to get pregnant or that ideal time to become pregnant that's based solely on a woman's body and the health of the ovaries. But if you've been pregnant before and you're having difficulties, there are other things that you need to be mindful of, whether or not your menstrual cycles are normal, if you're having any type of gynecologic problems, if you've had a delivery in the past that was associated with any type of complications, that may make the next pregnancy a little bit more difficult to occur once you get to that point. If you've been able to get pregnant easily in the past, the odds are you're going to have a very easy time getting pregnant again in the future. And although we think that we can change our likelihood of success through manipulation of our environment, there are very few things that we can do that will drastically affect your likelihood of success. But there are many important things that you need to be mindful of. A healthy lifestyle is probably the most important thing that women can keep in mind as they plan a second pregnancy or even as they plan a first pregnancy. We know that as body weight increases, and body weight increases generally with age, as you move into a career or as you have your first child, as your life changes with some of these events, just the amount of time that you spend for yourself, the amount of time that you actually have to pay attention to your healthy lifestyle begins to decline, and weight increases. And even a small, minor increase in a woman's body weight can affect egg production, can affect menstrual cycles, and it can affect...
Increase in weight, like getting outside of the boundaries. I have so many questions already.
Right.
I'm sorry, and I'm sorry.
No, please, this is very informal.
That you mean like an increase, like nothing related to their, range of healthy weight, but you're talking about now
Just, yeah, I mean, as...
over the limit of maybe
well, we know that
10 10 or 5 or 10 pounds.
Right, even, 5% increase in your body weight, depending on where that starting point is, can have a significant effect on your menstrual function.
That's
We know that
huge.
we've correlated what's called body mass index, which takes into consideration your height and your weight with likelihood of pregnancy, likelihood of success with any of our more advanced treatment options, and we see a decline in your likelihood of success as your body mass index gets high. Now, we consider a body mass index of 30. Now, my body mass index is 24. A few pounds heavier, 5 pounds heavier, I would be at a body mass index of 25 or 26. It's a pretty rapid change in that BMI. But at 30, which many women are fairly close, and I would say probably over half of our patients have a BMI that puts them in the range that's considered obesity. As it moves over 30, we see significant problems just related to body weight alone. That's something that we have control over. That's something that we have to keep in mind. Not only does it affect fertility, obviously, but it affects your health as you plan, hopefully, a long, happy, healthy life with the children that you're hopefully planning on having. And that involves exercise and diet. Avoiding smoking, obviously, is another lifestyle choice that is under our control. And we know that women who have smoked and women who are smokers have a shorter reproductive lifespan. Women go through menopause at an earlier age. Menopause is the time in which the ovaries have exhausted the number of eggs that are available, because all women are born with a set number of eggs, and over time they're gradually lost. There truly is, unfortunately, a biological clock. It's the number of eggs that are slowly being lost from the ovaries, such that on average around 52, most all of the eggs are exhausted and menstrual cycles end. But women start to experience fertility difficulties about 13 years before the onset of menopause. And if you are a smoker, then on average women go through menopause 2 years earlier than they otherwise would. And so they start to experience fertility issues 2 years earlier than they otherwise would. When we look at the population of women, we really see that after 40 it becomes difficult for pregnancy to occur, and it becomes difficult for us to help make that happen with the eggs that are available. For women who smoke, on average that's around 37 or 38. A little bit earlier that we start to see this drastic decline. That we have under our control. Alcohol, caffeine, within moderation, we haven't really seen any significant effects on an individual's overall likelihood of becoming pregnant through the moderate use of caffeine, 2 cups of coffee a day, glass of wine a day. In some studies hasn't shown to affect couples' likelihood of success. But we do know that when couples are experiencing difficulties and they begin a comprehensive program of wellness, including counseling, stress management techniques, elimination of alcohol and caffeine from their diet, pregnancies occur more often. Now, it's probably a combination of all of those factors affecting one's general lifestyle and their general state of well-being. It's hard to break out whether or not it's stopping the alcohol, stopping the caffeine. But these are again, lifestyle choices that within moderation shouldn't cause any problems, but something you have to be mindful of as you plan for a healthy future. But that healthy future also increases your likelihood of being able to get pregnant easily once you get to that point. And we often see stress that individuals experience in their lives affecting many things, their relationships, how they feel about themselves, and their general health, including the ability to get pregnant fairly
It's like a
easily.
vicious cycle. That separates the stress, and then the stress just gets worse.
It is, and if women or couples begin to experience difficulties, if their plan is somehow altered through factors that are beyond their control, then it increases the amount of anxiety and stress that couples have, stress within the relationship, stress about how healthy you are, concerns about what's going on with my body. That's not allowing this to happen. Everyone has a life plan. Most people have a life plan. Once you decide, okay, we're going to have baby number 1, or we're going to have baby number 2, you want it right then. And that's your plan. You have an idea, okay, by the time I'm 38, I'm going to have 2 kids in elementary school, and by the time I'm 40, they're going to be in middle school, and 50, they're going to be graduating from high school. That's a plan that people have in their minds. And if there's anything that's beyond their control that begins to alter those plans, it becomes very stressful. Unfortunately, some couples don't survive that stress. But during the process, or even before that process, there are other things in our life that can cause stress. I mean, I talk about mindfulness of how your body is functioning physiologically, what your menstrual cycles are doing, any gynecologic problems that you know of already, asking questions with your doctor whether or not these issues can affect your likelihood of success even before you start trying is important, but also mindfulness of your situation, your levels of stress, what's going on in your life, what's going on outside of all of those issues that seem to take up all of the time during the day, especially if you have kids. And if you have a career and kids, and you have other aspects of your relationship that might be draining a little bit of time from you, being mindful of how you're feeling, being mindful of your own health, and taking time for yourself is going to help eliminate some of that stress that can only improve your overall level of well-being, your health, and as a byproduct of that, pregnancy does happen more easily when we're in a less stressful environment. When couples are having difficulties, seeing somebody about it early is helpful, especially if you've had kids before, or if you're in a period of time in your life in which we know it becomes a little bit more difficult to get pregnant after 35. Yes?
I have a question specific to that I've been asked by some of my clients. I want to know, like, my interpretation is to see a fertility specialist early on. How do you know when you're not having, when it's time to go see one after trying for how long? Like a year? Do you just say, okay, it's been a year, we need to go right now?
Right. Well, if there are any issues that are concerning a woman about a change in, like I said, menstrual cycle length, the amount of bleeding that a woman has each month, any increase in pelvic pain, any health issues that are going on that are causing a level of concern, even before you begin attempts, an evaluation to see if any of those issues are going to affect your likelihood of success would be recommended if it's causing some anxiety for you. Now, we never know how easy it's going to be until a couple actually tries. And we consider someone to have infertility, the definition of infertility, if they're under the age of 35 and they've tried for a year with regular cycles and no other health issues interfering and aren't successful, or if you're 35 or above and you've tried for 6 months without any other issues that may be affecting that likelihood of success. Yeah, that's what our definition of infertility is.
Right. So when do you know you have a problem, or when you just kind of wait it out?
Under 35, normal periods, and you've tried for a year. Over 35, normal periods, no complications, and you tried for 6 months.
That's our medical definition of infertility. Now, that has some implications. Some insurers will cover infertility treatments, but they'll only cover it if you satisfy that medical definition of infertility. But if you're having difficulties at all and you have some anxiety about how easy it's going to be, if you're concerned that based on your situation, your health, your partner's health, the amount of stress in your life, the limited window of time that you may have to be able to conceive, then initiating at least an understanding of the presence of any potential problems earlier rather than later is best. You're always able to continue to try on your own knowing that everything's normal. And our fertility evaluation is pretty minimal. We look at different things to try to understand if there's a significant problem that's always going to prevent pregnancy. There are some things that might make the process a little bit less efficient, that may cause a couple to need to try for a few extra months compared to what is considered average, and we can sometimes identify those things, correct those things so that it happens a little bit more quickly, but also just sometimes relieving some of the anxiety about whether or not it's going to be difficult or whether or not we expect that there isn't any problem can make those attempts a little bit less anxiety provoking and just increase the overall likelihood of success through easing a little bit of that stress. So any couple or any individual who has anxiety about that process should consider seeing someone about those issues, discussing the tests that we usually do to understand likelihood of success, and possibly finding out ahead of time if there's a significant problem. But if anybody has any type of gynecologic history or menstrual irregularities, or their husbands have had changes in their health, changes in sexual functioning, exactly, all of these things can have significant effects. They can prevent pregnancy from occurring, and it's best to find out before you spend any more time trying for 6 months whether or not there's a significant issue.
What are some of the tests?
So our basic evaluation tries to understand how well the ovaries are functioning through understanding the menstrual cycle and understanding where a woman is in their reproductive life. And we use an ultrasound visualization of the ovaries and some blood tests to understand if your ovaries are functioning well or as well as we expect them to be functioning for a given individual age, or if there may be some additional concerns that the ovaries might not be producing as many good eggs as we otherwise would expect. We call these tests ovarian reserve tests. And the most reliable test that we have is a hormone measurement called anti-Müllerian hormone, or AMH. And it's a hormone that's produced by the number of eggs that a woman still has left within the ovaries. It gradually declines over time, and we can take a snapshot of that hormone, and it gives us a general understanding about someone's ovarian function. When that level gets low, it's more likely to indicate that a woman may have difficulty conceiving, and it might be worthwhile considering treatments earlier rather than later, or considering more advanced treatments earlier rather than later. If all of the tests are normal of how well the ovaries are functioning, then all we can say is that a woman should have ovarian function that's equivalent to a woman the same age. And when we look at the age-associated likelihood of success, it declines, as I mentioned, and that's unfortunately something that we're very concerned about because we can't really do a lot about that. And it limits what we're able to do. And I know it's hard to see on this graph, but at 24, that's the peak of fertility. That's when you have a likelihood of success that is as high as it ever is. By 30, that likelihood of success is already decreased by a half. And by the time women are 35, 39, or 40, 45, you have a much lower likelihood of success to conceive. But even at age 24, a couple has about a 20% chance of getting pregnant each month. It takes a few tries. By 40, that likelihood of success is only about 5% per month. So it takes a little bit longer for a pregnancy to occur when you're releasing a single egg each month. Those are changes that we can understand, especially if they're happening a little bit earlier than otherwise expected. Some of our measures of ovarian reserve may indicate that a 35-year-old may have an ovary that's functioning more consistent with a 39 or 40-year-old, and they may have not as much time to be able to utilize what's available to increase their likelihood of success significantly. So testing and understanding how well the ovaries are functioning is one thing that we do in everyone, even in 25-year-olds who are having difficulties getting pregnant, because we do see some younger women who start to have some of these ovarian changes earlier. We need to know if the anatomy is normal, whether or not the inside of the uterus and the fallopian tubes are normal. Anybody who's had a prior C-section, got pregnant easily and had a C-section, may have changes to the lower part of the uterus that might keep sperm from being able to swim normally into the uterus, or may affect how embryos attach and implant. Scar tissue within the uterus, changes over time, such as muscular growth within the uterus called fibroids, can alter a woman's likelihood of success, such that it's easy at a younger age but more difficult, even though you don't expect those problems. And a simple X-ray test and ultrasound of the uterus helps us understand the anatomy. Those are really the only two tests that we have for women, and of course a semen analysis to identify about 35% of the fertility issues that we see in couples who are having difficulties. That simple test helps us understand the whole male half of the equation. And there are changes that can occur with men over time. Men may have a normal sperm count or a sperm count that's in the lower end of normal at a younger age, and it may change. It doesn't change significantly with age, as the likelihood of success changes significantly with women. But life changes, lifestyle changes, smoking, weight gain, other hormonal issues that can affect men as well as women can decrease that sperm count over time.
Another question about on the female side, not on the male side. the birth control pills, do they have an effect? Because I always thought that, my girlfriends who went on the pill early in life, in high school, and were on it for a long time, had difficulties conceiving, and the different prescriptions, the different types of birth control pills have changed throughout the years, and they've improved, and this and
And
that.
I knew people
Yeah.
that had the IUD, then they have scar tissue, and then they have.
Yeah.
So
those
birth
people
control
seem
in
to
general,
be
like, is there any kind of study that shows the correlation between the ability to get pregnant
And
and
the
the ability
prior
to
birth control?
right
Yeah.
after using it, so that people, I mean, that would be a great.
My doctor told me the opposite, that the pill is the best thing, it preserves your fertility.
Well, yeah, I mean, pills don't preserve your fertility at all. You're still losing the same number of eggs each month while you're on pills. You just don't have one that's growing. There's a group of eggs
It's
every day.
misinformation that's out there.
There's a group of eggs every day of a woman's life that can start to grow. And those eggs that are available at the start of the menstrual month, where the hormone levels are different, begin to grow. One selects itself, the others die off. In the middle part of the month, when an egg's about to be released, there's a group of eggs that can start to grow, but the hormone situation is such that those eggs don't grow. Even while you're pregnant, there's a group of eggs every day that's available to start growing, but the hormone levels are such that they just don't grow. Pills are the same way. You're on pills, you've got a steady level of hormones, there's no stimulation, but you're still having a group of eggs every day that's available to grow, and they don't grow, they just undergo what we call atresia. They just fall by the wayside. So you're constantly losing eggs regardless of whether you're taking pills, whether you're pregnant, whether we're stimulating more eggs to grow. The same number of eggs are ready to grow each month, we just can keep. Sometimes 20 or 30 eggs growing if we're doing in vitro fertilization. You're not losing eggs anymore rapidly. So pills don't preserve your fertility at all, but there have been many, many studies that indicate that there's no significant decrease in your likelihood of getting pregnant from being on pills the month before or being on pills for years before. Your
There's no,
likelihood of success, no
No
difference. Now, there are changes with time. You know, women do. I've seen many women who started pills when they were 17 years old, and they stopped them when they were 35 because they're ready to get pregnant. And then they had difficulties at that point, not because they were on pills for those 18 years, but because
other things.
they were 35 years old. Or many women start birth control pills because they have irregular cycles, and it helps control those menstrual cycles. It helps control irregular bleeding, and once pills stop, then those irregular cycles sometimes come back, and that can lead to fertility issues as well. Endometriosis is another condition that causes pelvic pain that contributes to infertility. Endometriosis can be controlled with birth control pills. Women typically have very light
When you go
periods,
off of it,
no
then the
pain.
situation is-
When you go off, the endometriosis is still there.
I understand.
So pills themselves, just for birth control, have never been shown to decrease your likelihood of success.
So
So that's our
Lisa-
evaluation.
Oh, sorry. I was just going to mention that Lisa's going to walk us through a shortened fertile yoga class in a few minutes. I thought this might be a good time if anyone has any last questions.
I have one.
Yes.
There you go.
Oh, yeah, Irene.
My question is more on where I am.
Right,
my stage,
of course.
What your thoughts are on improving air quality, the CoQ10 and DHEA.
Right.
Because I've read and I've heard and I still can't make up my mind if it's a good thing or not a good thing.
It's, you know, as we know that the number of eggs begin to decline as women move through their reproductive years or even earlier, but also the quality of the eggs changes such that even though a woman's releasing 12 eggs a month, they might not be releasing 12 good eggs. The quality begins, and we don't understand that quality completely. We do know that coenzyme Q10 is a vitamin. It's a supplement that is safe, but it also helps improve health of the mitochondria, which are the energy-producing cells within the egg. And the mitochondria within the egg have been shown in some studies to be more abnormal as women age, and it's thought that coenzyme Q10 may help improve the health of these energy-producing organs within, or organelles within the egg. There's no good data to suggest that it will help improve egg quality. There's no studies that say coenzyme Q10 increases your likelihood of getting pregnant. And so the data is if we base the use of that medication on studies that have been done that proves it works. Well, there aren't any studies that proves that it works. But there are some theoretical reasons why it can and some physiologic reasons why it can. Unlike other Chinese herbal supplements or other things that we can't relate directly to physiologic processes that may help improve the functioning of the egg, coenzyme Q10 is one of those supplements that very well, based on physiology, help. And it's over-the-counter, it has other benefits, and it's inexpensive. And if it can help, it's worthwhile trying.
Is there a downside?
There's no downside. Cost, taking another pill a day.
Okay.
Are you talking about CoQ10 and DHEA?
CoQ10, coenzyme Q10 only. DHEA is a weak testosterone, and some data suggests that when we're stimulating eggs to grow within the ovaries, that if there's a higher amount of circulating testosterone, the eggs might respond to our stimulation medications, or the ovaries might respond to our stimulation medications better. There may be more eggs available to start to grow when we give a woman some stimulation medication. And so DHEA as a weak testosterone, we hope that it's helping allow more eggs to grow when we start stimulating the ovaries. So DHEA can help increase, or we think that it may help increase the number of eggs that are produced when we're trying to get as many eggs as we can with in vitro fertilization or with other less involved treatment options in which we need more eggs to be produced. It's not going to give you a better chance to get pregnant just taking it on its own. It's not going to help increase the number of eggs that are naturally growing. Usually you're only going to get one, and that one egg is not the health of that egg isn't improved by DHEA. But if you're on medication for infertility, the DHEA may make that medication work a little bit better. But we've also seen in a few studies that are out there that women may tend to respond better if they've been on that medication longer. So, one study showed that just looking at one individual who had a very poor response to IVF with very few eggs, she started on DHEA. The next time she did IVF, she had more eggs. And the next time she did IVF, she had even more. And the sixth time, unsuccessful time she did IVF, she had quite a few more eggs than she did the very first time. The only difference was that she was taking that DHEA. Not great data, basing our decisions on one account of one person's experience. But DHEA is, again, an over-the-counter supplement that's safe, that doesn't have any downside to take. And if it's worthwhile taking for a period of time, I apologize for that. If it's worthwhile taking.
It's kind of hard to, because some of the information you get is online.
Right.
And you don't know, and you have people who will say that there is no adverse effects, and then there's people, you read things like, well,
Especially
don't
if
take it. It's like the worst thing you could do because
That's
it
the
doesn't.
testosterone you're taking off.
Well, it's
it's
a
like-
weak testosterone. It can. I have someone who started taking that medication, and they've noticed more acne and greasy skin, and those are all side effects of testosterone circulating within your system. And so for some, it can have some of those changes. But for a period of time while you're trying or while you're considering treatment, it's worthwhile to consider because those side effects are minimal and they're very rare, and it's a safe medication as long as you're using a reputable medication. There was one study looking at over-the-counter DHEA because in the past it's been used by many individuals in their 40s and 50s just to help boost energy levels because testosterone can make you feel a little bit more energetic. And studies have shown some of those over-the-counter supplements had 0 DHEA in it, and sometimes they had 200% more, or twice as much as what was
And mercury
actually
is
advertised
derived
there.
from
So, but a reputable source of DHEA is what we usually recommend when we have a nutritionist as part of our practice that has researched all the different formulations that are available, and we offer that to patients so they know they're getting a good grade of DHEA.
Mm-hmm.
And we do recommend that when we consider both of those things, because if there's anything that can help and it's not going to decrease your likelihood of success, and it's not too expensive, and there are a few risks associated with it, then it's worthwhile trying. But unfortunately, we're limited in what we can do to help improve egg quality. We haven't found anything that definitively improves the quality of the eggs when we're dealing with, and a lot of those changes are age-related.
I have a question. So what are the good prospects for someone who's facing these kind of issues? What are the options?
Well, depending on the specific problem, certain treatments may be necessary. But in general, if someone's having difficulty and we're dealing with age-related changes, which commonly affect women who've had pregnancies before, our treatments our simple treatments work well. Our more advanced treatments, such as in vitro fertilization, work even better. And these days, with in vitro fertilization, we have the opportunity to test embryos. We can test the chromosomal makeup of the embryos, which is something that changes over time as well. As women move past 35, we start to see more miscarriages due to abnormal embryos. We start to see incidence of Down syndrome increasing. We see infertility related to just abnormal embryos coming from eggs of poor quality. And we found that if we could identify those normal embryos and get even one normal embryo back into the uterus, we've got a much higher likelihood of success. And sometimes it takes a woman 3 or 4 stimulations of the eggs to find that one normal embryo, but our testing these days allows us to do that and increase the likelihood of success. And when we look at data, if we can find one normal embryo in somebody who's between 40 and 44, that age group, and get it back into the uterus, their likelihood of success is just as good as women who are less than 35 getting one normal embryo back into their uterus. It's just that women at 40 and 44 might not have as many good quality embryos that we can identify to get back into the uterus. Sometimes takes a little bit of time to get enough eggs to be able to identify that. And we've tried to develop programs to allow individuals to go through the process multiple times with a minimal cost, because everything that we do has a cost associated with it, and sometimes it's not covered by insurance, unfortunately. But the newest thing that we're doing now is testing embryos even before we're able to get them back in the body to eliminate the risk of miscarriage, to eliminate those situations in which we're putting abnormal embryos back in that just are going to lead to a negative pregnancy test, and we don't know why that is, and to decrease the risk of Down syndrome that can occur more commonly as women move through their reproductive years.
Is there a big difference between the pregnancy rates when people go through that kind of test?
Our pregnancy rates are higher when we're able to test embryos, and beyond that, we're able to have pregnancy rates that are just as good putting one embryo back as opposed to 2. No longer are the days when we put 5, 6, or 7 embryos back. We've gotten better at identifying the most normal embryos, but still, our society guidelines say that for women who are, over 35, we could put 2 embryos back. Women over 40, we could put as many as 5 embryos back, and that's still acceptable because we know that not all of those embryos are normal. At times, we see triplets, and not very often in the past when we used to put 5 embryos back. Our practice, we just put 2 embryos back. We're good enough with our identification methods in the laboratory that we can pick 2 embryos and have just as good a chance as if we put 5 embryos back. But sometimes those aren't normal embryos, or sometimes we're putting 2 normal embryos back, and twins still have some risks. And our newer techniques allow us to put 1 embryo back and have pregnancy rates that are much higher than we have in the past, but also as good as when we put multiple embryos back into the uterus. So we've gotten more advanced at identifying those normal embryos. What we're still not able to do is change the eggs that we have available to work with. And we do have a finite supply of eggs that we're able to work with. If a woman has experienced changes to the ovaries at an earlier age, such that we believe there are very few good eggs remaining within those ovaries, we're not able to stimulate those eggs to grow, there's always the option of using a donor egg. It's not ideal. Everyone would like to have their own genetically related child. But when we use eggs from an egg donor in their early 20s, we have extremely high likelihoods of success. We use the husband's sperm, donor egg, and we put that embryo back into the woman's body, and she's pregnant with a very high likelihood of success. That's the only treatment we have that truly overcomes egg quality issues, but that's using a different egg. That's another level of acceptance that we allow women up to the age of 50 to 55 even to go through that process. Because again, as women move through the reproductive years as well, there are more risks that occur with pregnancy as well. But the only significant thing that changes with age that can cause an abnormal pregnancy is the likelihood of an abnormal embryo associated with the DNA content, such as Down syndrome and miscarriages. And those things we can test for ahead of time to eliminate that potential risk that may occur just because women aren't ready to get pregnant or they're putting off having that second child for a little bit longer.
Wow.